On behalf of Children and Family Futures and the Family Drug Court Learning Academy, welcome to our webinar presentation. Special thanks to the Office of Juvenile Justice and Delinquency Prevention, who supports the National Family Drug Court Training and Technical Assistance Program. For more information about Children and Family Futures, the Learning Academy, and the Family Drug Court Training and Technical Assistance Program, please visit our website at www.cffutures.org. We hope you find this presentation helpful as you strengthen your partnerships and improve outcomes in your family drug court.
Hello, my name is Sherston Freskin, and I want to welcome you to our presentation, Why Housing Matters for Family Recovery, Stability, and Public Safety. Today, we will explore why housing matters for some of the most vulnerable families in our communities. 1 in 5 families who enter a homeless shelter for the first time are subsequently involved in child welfare. Roughly 13% of children entering foster care in 2018 were removed at least in part because of inadequate housing. Approximately 1 in 6 families investigated for child neglect and abuse have housing problems that threaten child safety. And approximately 1/2 of young adults seeking homeless services had previous child welfare involvement. For many families, a safe and affordable home can be the difference between keeping children with their parents or having them taken away and placed into a foster home. A house, or lack of one, can be the reason a parent cannot and will not regain custody of their children. For a parent in recovery, a house can be the difference between entering and staying in substance use treatment and maintaining a life of recovery, or dropping out of treatment and continuing to use alcohol or other drugs. For a parent trying to support a family, a house can be the difference between finding, keeping, or losing a job. For school-aged children, a home can be the difference between succeeding or failing in school. For older youth, a home can be the difference between a successful transition into adulthood or becoming one of many youths who experience homelessness within a year of emancipating from the foster care system. Longitudinal evaluation studies by researchers from University of Chicago's Chapin Hall Center for Children found that 24% of youth were homeless after exiting the system, and nearly half had been incarcerated within 2 years. In this presentation, we will explore why, how, and what your team can do to connect housing resources to families involved in the child welfare system, working towards recovery and reunification. The lack of stable housing has been raised by family treatment court teams as one of the most significant barriers for families. But we also know that this issue is significant for all families in the child welfare system. Whether you are part of a family treatment court program or not, we hope this presentation will provide helpful information on how to engage with partner agencies and systems in your community. We also acknowledge that every community is unique. Whether you come from a community that has a full continuum of housing options or one where resources may be severely limited, we hope this presentation will spark important conversations and perhaps ignite a vision for your community. So let's get started. A key first step is to establish why housing is critically important to families involved in the child welfare system who are affected by parental substance use disorders. We will look at a couple of frameworks to help us understand housing as a basic need and housing as essential for recovery. Housing is a basic need. At the foundation of an effective response is the understanding of housing as a basic human need. We don't have to look further than Maslow's hierarchy of needs, where the needs, starting at the bottom, are physiological, safety, love and belonging, esteem, and self-actualization. According to Maslow, before the higher need can be fulfilled, the lower needs must be met. As you can see, housing is foundational to everything we do, right along with breathing and eating. Maslow's framework urges us to re-examine inherent biases about families who are affected not only by insecure housing, but also by a myriad of other issues, including mental health and substance use disorders, trauma, and domestic violence. Housing is essential for recovery. Similarly, housing is also essential for recovery. First, let's remind ourselves what recovery is. Recovery is more than just abstinence, negative drug screens, or graduation or completion of a program. According to SAMHSA, recovery is a process of change through which individuals improve their health and wellness, live self-directed lives, and strive to reach their full potential. SAMHSA has delineated 4 major dimensions that support a life in recovery. A home means having a safe and stable place to live. Health means overcoming or managing one's disease or symptoms. For example, abstaining from use of alcohol, illicit drugs, and non-prescribed medications if one has a substance use disorder. And for everyone in recovery, making informed, healthy choices that support physical and emotional well-being. Living in community means having relationships and social networks that provide support, friendship, love, and hope. And finally, having purpose means conducting meaningful daily activities, such as a job, school, volunteerism, family caretaking, or creative endeavors, and the independence, income, and resources to participate in society. As you can see, these 4 domains of recovery align nicely with Maslow's model. A safe and stable home is the foundation all families need to achieve and maintain recovery, be safely reunified and care for their children, and establish permanency that affirms their dignity. Individuals and families must have a home in order to engage in treatment, employment, parenting, child well-being, and other activities so they can achieve stable recovery to care for themselves and their families. For example, housing not only provides a safe and healthy place for families to live, it also reduces stress for the parents so they can concentrate on treatment, recovery, parenting, and employment. A home can open opportunities for services to be delivered in the home, which can be the difference between keeping kids with their parents or placing or keeping them in a foster home. Many people experience improvements in quality of life, health, mental health, substance use, and employment as a result of achieving safe and stable housing. Lack of a stable, alcohol and drug-free living environment can be a serious obstacle to sustained abstinence. A safe and stable home also means children are not forced to miss school or change schools. A stable home allows them to achieve academic success. And a home connects a family to a community and larger supportive networks, enabling them to establish meaningful relationships. And housing instability is associated with adverse caregiver and child health among low-income renter households, according to a study published in January 2018 by Pediatrics, the official journal of the American Academy of Pediatrics. This study evaluated 3 forms of housing instability for families: falling behind in rent, multiple moves, and history of homelessness. These findings showed that each of these 3 circumstances were individually associated with increased adjusted odds of adverse health and material hardship compared with stable housing. As you can see, housing is not just about housing. Housing is about health, building social connections, finding purpose, and belonging. There's a growing understanding that investing in housing stability is the platform for success for nearly every goal we want for our families working towards recovery, safety, and permanence. Your team can champion and articulate a clear vision for these relationships between safe and stable housing and achieving positive child and family outcomes. The importance of housing is also highlighted in the recently published Family Treatment Court Best Practice Standards. Ensuring adequate, affordable, and safe housing is a critical component of the family's comprehensive case plan. After establishing the why, your team should focus on key approaches you will take. So now let's talk about the how. Collaboration is essential. Families involved in the child welfare system and affected by substance use disorders and housing instability are some of the highest needs families in your community. Their needs are complex, requiring a wide range of expertise and resources that no one agency is able to provide. Therefore, the most effective approach is to improving housing stability, family functioning, and child well-being through cross-system collaboration. Meaningful collaboration may seem elusive, but there are successful examples of jurisdictions that have assembled community partnerships integrating affordable housing and support for families affected by unstable housing, substance use disorders, and child maltreatment. A good first step for your team is community mapping with particular focus on housing and housing supports. You may be familiar with this collaborative process, which has enabled many communities to find which resources exist to solve a particular problem. This tool will help you align and coordinate across all sectors while working towards achieving shared outcomes. Please contact us if you would like more information about facilitating community mapping. Family voice is essential. In addition to partnering across systems, it will be important to partner with families and ensure family voice. Family voice involves talking with families, asking them what they need, and if there are particular approaches or resources that would be helpful to them. Honoring family voice is critically important because the families involved in our child welfare and court systems are afraid, may have had experiences that have taught them not to trust, and are in many ways powerless. These families are reluctant to engage with public systems due to unequal power dynamics, their own trauma histories, and experiences with systems and institutions. As you engage in this work, explore opportunities to intentionally partner with families and help them be the architects of their own future. One way to build trust is to authentically engage families through family teaming or family conferencing. These can be powerful strategies for engaging families and agencies and to support staff in their efforts to coordinate service planning while also being client-centered and empowering. By listening to families, you will not only garner their trust, but you will also learn what they need. Avoid the common mistake of making decisions and plans without their input. You will need them to ensure that your strategies and solutions are effective. Make sure families have a real seat at the table to voice their needs and preferences. Family voice also provides a personal witness to the community about addiction and recovery. These families can normalize the process of recovery, providing positive examples of what recovery really looks like. As a result, they will be your greatest champions for garnering wider community support and resources. There's a quote by Meg Wheatley that says, "You don't fear people whose story you know." When people see recovery close up, the thick walls of bias and stigma that create real barriers for these families begin to break down. Housing first. Next, your team can help advocate and support a housing first approach, which seeks to connect families to permanent housing quickly and successfully without any preconditions or barriers. Housing first programs do everything possible not to reject an individual or family on the basis of poor credit or financial history, poor or lack of rental history, minor criminal convictions, or behaviors that are interpreted as indicating a lack of quote-unquote housing readiness. Prior to the development of Housing First, most housing providers had preconditions such as sobriety before a person could enter housing. Further, individuals generally had to advance through the steps of emergency shelter and transitional housing before they were considered ready for permanent housing. Experts favor the Housing First model because it accepts that stable housing is the fundamental precondition for recovery and health. In other words, if you first house someone, that individual is much more likely to be able to successfully engage in treatment and the other desired behaviors that are often preconditions in other kinds of housing problems. Also, research studies conducted in different cities have consistently found a housing retention rate of 85% after 5 years in Housing First programs. Client satisfaction is similar in both Housing First programs and programs that require treatment for either a mental health or substance use disorder before housing. Housing First is an evidence-based approach that places an immediate and primary focus on helping families and individuals access permanent housing quickly and then sustains permanent housing by providing comprehensive wraparound services, appropriately trained staff, and buy-in and support among program leadership and partners. For those families who still maintain custody of their children, the Housing First approach can be particularly meaningful. In fact, some experts argue that intact or in-home families are likely to benefit more from Housing First than families looking to reunify. Housing First models will be drawing greater attention as a result of the 2018 Family First Act. Since studies have consistently shown that 30% of children in foster care would not be in care if their families had adequate housing, the need for advocacy for housing resources to support families is huge. Under the Family First Prevention Services Act, states can opt to use Title IV-E foster care funds more flexibly to help children remain safely in their homes and prevent foster care placements. Advocate. Lastly, your team will want to adopt an approach that advocates on behalf of families. We know that there are many specific exclusionary criteria that are real barriers for families to accessing secure housing, including addiction, criminal history, poor credit scores, prior evictions, and the high initial costs of entering housing, including first and last month's rent and security and utility deposits. In many of these situations, housing providers can exercise discretion in how they decide to enforce certain requirements. According to HUD's rules about drug use and criminal activity, it says that housing providers can consider whether a household member is participating in or has successfully completed a supervised drug or alcohol treatment program when determining whether to deny admission or terminate tenancy for illegal use of alcohol or other drugs by a household member who is no longer engaged in such behavior. Another form of advocacy is helping housing partners identify priorities and preferences. These criteria are often used by local housing authorities to sort through and prioritize housing for the thousands of people on the waiting list for assisted housing. Usually, families at risk of separation or needing housing to reunify with their children are a local housing authority preference. As you talk with your local housing authority, ask about their preferences. If families involved with child welfare are not part of their preferences, work with them to get them added. If they are part of the preferences, widen who is eligible and work together to secure more spaces to be made available for your families. For instance, you can widen eligibility to include those at risk of being homeless or at risk of separation. Your advocacy will help create opportunities that would otherwise result in shut doors for these families. After establishing the why and how, your team will be better positioned to implement what works for these families. In the next few minutes, we want to highlight what your team can do to move towards a more coordinated and integrated approach to building housing supports for families working to achieve recovery, safety, and permanency. Universal screening and comprehensive assessment. One strategy your team can take is to proactively identify housing instability among families entering the system and connect them to the services needed to keep families together. Under a Housing First approach, screening for housing is moved up during the investigative stage rather than waiting until much later, right before a family is preparing to reunify or is entering aftercare. Adopting simple screening questions, similar to what the Veterans Administration implemented, can help identify families who are at risk of insecure housing, connect them to appropriate services, and learn more about how to target and prioritize interventions. Known as the Homelessness Screening Clinical Reminder, the VA was able to implement a simple strategy that includes asking 2 simple questions. 1. In the past 2 months, have you been living in a stable housing that you own, rent, or stay in as part of a household? 2. Are you worried or concerned that in the next 2 months you may not have a stable housing that you own, rent, or stay in as part of a household? All families receiving child welfare services would receive this simple screen, which would be administered as early as possible, perhaps during investigation. Families who screen positive for homelessness or risk of homelessness would be asked follow-up questions about their current living situation and whether they would accept referrals for services. Another example of universal screening is to ask everyone who applies for income-restricted housing if the family currently or has ever had an open child welfare case. This would help establish the baseline data of shared need between child welfare and assisted housing and would help identify families for housing preferences and specialized housing choice vouchers, such as the Family Unification Program, or FUP, which we will talk about more in a few minutes. Responses to these universal screens would then be documented in the case management system along with additional information gathered through their case. Those who are screened and identified to be at risk of homelessness or unstable housing should then be referred for a comprehensive housing assessment. The assessment should also include identification of complementary supports and services to support recovery, safety, and permanence, such as food and clothing, medical care, child care, transportation, employment, education, domestic violence, and legal assistance. Some child welfare agencies employ a housing liaison co-located at their offices to conduct an assessment, facilitate referrals, and provide information about the most appropriate options. Some communities have moved towards implementation of local coordinated entry systems to ensure there are no quote-unquote wrong doors when referring families for housing support. Coordinated entry involves conducting the same intake and assessment at all local agencies where families may present seeking help. This ensures referrals use the same criteria and allows for access to the same set of resources for everyone. Coordinated assessment is utilized to help agencies determine the best program match to meet the identified needs of each person or family experiencing homelessness. By implementing a systematic approach towards screening and assessment and collecting its results, you will be able to use data to target families most in need. This kind of process might look like: illuminate the need. First, screening and assessment results can be used to develop baseline data identifying the housing needs of families and youth in your community. Understanding the scope. Linking results with child welfare administrative data and other available data can be used to understand the comprehensive needs. The use of administrative data systems can be used to understand the scope of housing issues among families and youth involved in the child welfare system. You can create and use data from different public agencies to develop a profile of those most in need of supportive housing. And advocate for resources. More importantly, documenting the needs of families can be used to advocate for additional housing resources and supports. Next, your team should gain a solid understanding of existing partnerships your child welfare agency has with local housing programs. In most communities, the Public Housing Authority, often referred to as the PHA, is the largest single source of affordable housing. There are approximately 3,300 PHAs around the country. These are funded by Housing and Urban Development, or HUD, to administer two major programs, the Housing Choice Voucher and public housing programs. Many of us are familiar with traditional public housing and the Housing Choice Voucher, better known as Section 8. With a Section 8 Housing Choice Voucher, the family has to find qualifying housing within 90 days of receipt. If they can't find a place to live that will accept their voucher and that will pass HUD inspection in that time frame, they lose the voucher. This is actually one of the biggest barriers families face. Your team should consider developing a relationship with public housing agencies to understand how their housing resources are being allocated at the local level. Some PHAs have institutionalized preferences for youth and families who are child welfare involved. For instance, in some communities, the PHA has partnered with child welfare agencies so they can participate in HUD's Family Unification Program, sometimes called FUP or FUP vouchers. This program provides vouchers to families who are in imminent danger of being separated or unable to be reunified due to housing problems, as well as for young adults between the ages of 18 to 24 who were formerly in foster care and who are homeless or at risk of homelessness. If your local PHA does not have FUP vouchers or has a limited supply, explore other types of options that are available. Your housing authority may have other kinds of specific housing choice vouchers which could be appropriate for your families. Now let's return back to the continuum and explore other types of housing programs that have addressed the housing needs of families with or at risk of child welfare involvement and provide stability for those families affected by substance use disorders. Let's look at rapid rehousing, which quickly moves families into private market housing by providing short-term rental assistance and services, with services ending once rental assistance terminates. The core components of rapid rehousing, housing identification, rent and move-in assistance, and case management and services, operationalize the Housing First approach, which aims to help people obtain housing quickly, increase self-sufficiency, and remain housed. While Housing First programs often serve many different populations, including youth, families with children, and the chronically homeless, rapid rehousing programs generally target people with low to moderate service needs. Now let's talk about residential treatment programs, since this is a pathway that many of your clients may take as they work towards recovery and reunification. Although more of a treatment recommendation than a housing intervention, residential treatment offers a safe environment and structure for stabilization, intensive treatment, and intensive recovery support. Residential treatment is level 3 of the ASAM continuum of care and is recommended for individuals who have multiple and complex needs. It can take place in various settings, including halfway houses and other extended care facilities, primary residential or inpatient programs, and recovery homes. There's short-term and long-term residential. Some programs allow children to live with their parent, and studies have shown that residential treatment facilities that provide integrated treatment services for mothers show more success than those that do not. Many communities have partnered with their local child welfare agency to facilitate an effective and supportive reunification process for parent and children. Transitional housing combines short-term housing and supportive services for families with significant barriers to housing stability. Traditionally, families seeking transitional housing were required to prove their ability to live independently for up to 2 years in a transitional housing program in order to earn a permanent housing voucher and supportive housing. With the emergence of the Housing First movement, the wisdom of mandating families to wait in transitional settings for any length of time has been reconsidered. This marked a shift from homeless service system with transitional housing as a link from emergency shelter to a focus on permanency. As a result, models have emerged in which families are offered permanent, affordable housing as soon as possible while providing a level of case management necessary to assist families in maintaining housing stability. Supportive housing, which leads us finally to supportive housing as a proven permanent housing option in many communities. Supportive housing is designed to serve individuals and families with the most complex challenges by providing a permanent housing subsidy together with case management and other services to help families successfully maintain their housing. Supportive housing is designed for individuals or families who, but for housing, cannot access and make effective use of treatment and supportive services in the community, and but for supportive services, cannot access and sustain stable housing in the community. These are families who are most likely to experience negative child welfare outcomes, such as out-of-home placement, long-term foster care cases, and those that have experienced a re-entry to the child welfare system. Those that are inadequately housed, either homeless or unstably housed, and those that have multiple and complex needs, including those with substance use disorders, mental or physical health problems, domestic violence involvement, and those with very young children, large households, disabled children, or other needs. In addition to a housing subsidy, supportive housing services can include substance use disorder treatment, mental health treatment, childcare, parenting skills training, children's services, employment, income, and education supports, training on daily living skills, health care, support in developing positive and supportive relationships, transportation, and support in reintegrating into communities. Case management support is provided to coordinate the array of services needed to address these issues and the family's interactions with multiple service systems, instead of expecting the family to navigate them alone. In 2016, the U.S. Department of Housing and Urban Development published the results of the Family Options Study, an ongoing randomized control study established in 2008 that compares the effectiveness and cost of 4 types of housing crisis intervention: permanent housing subsidies, transitional housing, rapid rehousing, and usual care, which means any kind of housing or services a family might find and access on their own, which often was an emergency shelter. The study demonstrated that permanent housing was the most cost-effective intervention of the 4 types. Perhaps more importantly, HUD evaluated the impact of each intervention on a number of child and family well-being variables, including child welfare involvement, family preservation, and school performance, and substance abuse by parents. For families receiving a subsidy, child separation was cut by 42%. Additionally, families receiving a subsidy reported drug or alcohol abuse was cut by 27%. You and your team can learn more about the Family Options Study and supportive housing by visiting the official HUD website. Another opportunity to learn more about housing in your community is to see if it has a continuum of care, also known as COCs. A COC is a network of people and organizations in a locally defined geographic area responsible for coordinating the local response to homelessness. COCs are responsible for providing a coordinated approach to homelessness. This coordinated approach includes identifying community needs, ensuring that resources are strategically prioritized to serve those that are most vulnerable, funding rapid rehousing of homeless individuals and families, and promoting access to supportive services for long-term stability. If your family has a COC, ask specifically about its connection to and involvement with your child welfare agency. Your local COC is a good place to start when seeking to identify the range of housing resources in your community for child welfare-involved families and youth who are experiencing or at risk of homelessness. For more information about the COC process developed by HUD, please visit the official HUD website. Lastly, your team can help housing providers and child welfare agencies understand each other's systems and what you can offer each other and the families affected by substance use disorders. Learn what these housing, child welfare, governmental, and non-governmental agencies can offer your families, such as available housing options, available voucher programs, family unification program, development-based and housing choice vouchers, veterans or other targeted vouchers, understanding program requirements and the application process, case management and economic empowerment programs, landlord engagement strategies, and strategies to maintain stable housing and prevent evictions. In turn, your team can offer housing providers an array of support, which could be a major incentive to housing and other service providers. These may include intensive case management to help coordinate services, any coordinated case management that you are already providing to families will be an important support to help leverage and maximize housing resources. The provision of case management can also serve as an asset that helps landlords and housing programs see these families as desirable clients and tenants. Services such as substance use disorder and mental health treatment, drug testing, parenting education, and counseling that help the parent, children, and family become healthy. And finally, increased accountability provided through court oversight and monitoring. The frequent staff meetings and court hearings of family treatment courts will be particularly meaningful for housing providers as well. Your team can also provide cross-agency training to increase a shared understanding of the problem and create a sense of mutual accountability. Instead of insisting that clients be housing ready, insist that your housing partners and providers be consumer ready. Your team can have a vital role in helping this paradigm shift in your community to be consumer ready by providing training in the following: how the child welfare system works and understanding court-mandated timelines, the particular needs of families involved in the child welfare system, particularly those who suffer from substance use disorders and other co-occurring needs, understanding substance use disorders as a brain disease and the importance of treatment and recovery support, how children are affected by parental substance use and how to prevent adolescent substance use, trauma-informed approaches and practices, motivational interviewing as an important frontline skill. These topics are particularly relevant for landlords and property managers who are working directly with these families. Due to frequent turnover within the community, your team should also be available to offer training on a regular basis. Today, we made the case of why housing matters and why you and your team should actively consider and prioritize the essential role housing has for families involved in child welfare and affected by substance use disorders. There are many barriers, thick walls, and shut doors for these families. There are, however, windows of opportunity, but only if we work together. Everyone has a role in creating communities where all children and all families can be safe and be together. But first, we must be better together. There are growing examples of innovative partnerships and solutions that can serve as a blueprint as we build strong families and supportive communities. Please view our cafe conversation on this topic to hear how leaders and communities are working better together to connect families to housing. We also encourage you to download the team discussion guide as well as our Take Action guide for some next steps. We hope you found this presentation helpful as you strengthen your partnerships, elevate your practice, and improve outcomes for families. Please contact us at fdc@cffutures.org if we can be of further assistance. And thank you.
Thank you for listening to our webinar presentation. To further your learning, please download the webinar discussion guide, which provides questions for your team to explore and next steps and resources to move your team forward. Again, for more information about Children and Family Futures, the Learning Academy, and the FDC TTA program, please visit our website, our Family Drug Court blog, or email us. Thank you, and we hope to see you again here at the Family Drug Court Learning Academy.